Judge Jenkins from Dallas County. Let's give him a round of applause. Well, thank you very much, Judge. I'll say your staff person, Ruby Bloom, has been a joy to work with. She's recruited 5 or 6 folks on our agenda today, so thank you for letting us have some of her mind share. Appreciate it.
Ruby's awesome.
Yeah.
I'm the product of great staff.
Yeah. So let me start with a similar question that I asked Fred, which is, during this time of sort of polarized health politics, where Dallas County is a little more blue, Texas is a little more red, how do you find sort of the politics and navigating the policy landscape in healthcare in this polarized period?
Well, with the career professionals that work for like DSHS, the people like Fred Schuster, it's a good working relationship. We're able to communicate quite well. The state's been a big help along with the feds. I made it a point to try to revamp the Ryan Wyatt program here over the last 18 months, nearly 2 years now, and they've been tremendous partners in that. The problem really gets to be my counterparts, the politicians. The politicians, you see this, and it's especially true with healthcare, and you're seeing it today with gun violence as well. People say one thing, but then they do nothing, right? I mean, if you look at the last special session, or the last session rather, of the legislature, they did nothing on health care. Maybe if you want to say, well, they dealt with surprise billing. Mm-hmm. But beyond that, any sort of Medicaid expansion, any sort of help for the 250,000 people in Dallas County who would benefit from Medicaid expansion, no help for them. And so when we look at our community health assessment that we're just finishing up, what we see is that if North Texas were a county, if Dallas-Fort Worth were together a county, we wouldn't be the largest county, but we'd be the most uninsured county in America. Texas is the most uninsured state. Dallas County, the uninsurance rate is more than twice the national average. And, it manifests itself in people without insurance dying a lot sooner and having less quality of life than people with insurance. So that's something that we deal with, and that requires us to do a lot more in public health.
What is Medicaid expansion becoming sort of a North Star in terms of healthcare policy and politics amongst Democrats in Texas? I mean, it has been sort of we've been talking about expansion for a decade now, since the ACA passed, or at least since the 2012 Supreme Court case. But it feels like Democrats are increasingly pointing to that as both politically smart and logically sound policy. Is it gaining momentum, would you say, as a topic, or has it always been this prominent?
I think it's gaining momentum in that when you look at more and more states are finding a way to accept their portion of federal tax dollars that go to Medicaid expansion. Texas is by far the largest state that, for political posturing, is sending all that money to the federal government and watching it being dispersed out to the other states. I hope it's not just a Democratic thing. I think it should be a healthcare provider thing, a compassionate person thing, a faith community thing. Because when we talk about Dallas County, so there's 2.6 million people here. Medicaid expansion would result in tomorrow 250,000 people who currently don't have coverage having coverage. And so, the difference in that, I tell the story to groups. I watched my dad suffer a fatal heart attack when I was 7 years old in a park in Oak Cliff. A week after we buried him, his half-brother went in and found that he had the same heart condition that my father did. He had surgery and had a pacemaker put in. He lived another 43 years, long enough to meet his great-great-grandchildren. Wow. So that's a personal story, but we all know these stories. I've got a friend from high school whose father is dying probably this month because by the time he got around to seeing a doctor, it was too late to help him. Mm-hmm. And so that story is playing itself out mostly in poor neighborhoods, mostly with people of color in Dallas County every day. So I'm hoping that the community will, this is what politicians listen to. Sorry to diverge, but the folks who were tweeting last month about how we need to buy more guns because California is beating us are the folks that are beginning to listen to you about gun violence, not because they've had a change of heart, but because the number one issue to a politician is to keep their job, and they listen to the public. So when there's an uprising in the public that we don't want people to die without health insurance, that's when the politicians listen.
Yeah, was that politician Governor Abbott that tweeted that out?
That politician was Governor Abbott that tweeted that out. But you've got a lot of our state leaders who fall all over each other to take pictures. Ted Cruz wrapping bacon around the muzzle of an AR-15 to show that he could cook bacon if he shot enough rounds fast enough. This fake machismo thing of falling all over each other to show who loves guns the most.
Yeah.
And that only changes when people, stand up.
So when people look at Dallas County and the healthcare system and the health policy leadership here, whether they're looking from Tarrant County or Harris and Bexar or San Diego County or Los Angeles County or wherever, what would be the highlights you would say about Dallas County that other folks should try to emulate? What are the sort of top bullet points?
Well, I think Fred will talk about Parkland. I think the turnaround at Parkland has been remarkable. We still have former board members. Last month, Debbie Branson was asked to speak in Washington, who was the chair of the Parkland board during the turnaround, about how to turn hospitals around and how to be the type of board member that can help with that. So that's been remarkable. I talked a little bit about the work that we're doing, that I'm leading on Ryan White, but also Phil Huang, our health director at DCHHS, and I have made this a year of sexual health. So like the rest of the country, you're seeing a rise in chlamydia and gonorrhea infections. So we're focused on, we become a fast-track city last month.
What does that mean?
That means you're signing the Paris Declaration to end the HIV and AIDS epidemic. So 90% of our citizens who have HIV will know their status. 90% of those will be on antiviral to keep their condition under control, and then 90% of those will have an undetectable viral load, so it's the disease is not transmittable. And then we've revamped and renamed we're moving away from the name STDs on our clinics into, sexual health, trying to take the stigma out of that, get people to get tested and know their status. That's a big thing. In Dallas County, we're real big on using data to try to promote public health, and then seeing when we do things, what actually works. Mm-hmm. Right. So, and I think that's an important thing that we're doing in Dallas that other people can, emulate.
What counsel would you give to this room of political and market leaders who are trying to, we're all very good at living in our silo, and sometimes we don't always know the success or the problems or challenges in the silo next to us. As you sort of think about these issues at a system level, both policy and political and operational in the case of supporting Parkland, what counsel would you give to these folks about how to navigate this time?
A couple of things. One, I think people in healthcare are compassionate people who care about others. But we've got a community, if you're from Dallas, and by the way, in the Affordable Care Act, wherever you're from, get this. Get your community health needs assessment, and the thing that you're doing in your neighborhood, look at the color that is the darkest on that map. Look at those zip codes and census tracts that are having the most acute health problems, and then go worship on on your worship day at a house of worship in that area. Don't make a big deal, but just go do it. Go eat at a restaurant in that area. Go try to do your grocery shopping. Go try to find a store and do your grocery shopping in that area. I think it's imperative that we stay in touch and in tune with the people that we are trying to help. And then I think get active with groups that are trying to promote change, like you're doing here today. So you had me. I'm up there, and then just one person. I'm up there every time there's gun violence, and I'm almost embarrassed to be doing these vigils with these faith leaders because I know politicians aren't going to do anything about this. And now what we're seeing with groups coming about, mostly led by students and other groups, we're beginning to see some things happen. And that's the power of organizing. And if healthcare could organize, if we, one, go see the people that are most affected, not just in a clinical setting, right, where you see them in the hospital, go see them where they live, go try to grocery shop in their neighborhood. And then two, if we organize, Republicans, Democrats, Independents, if we organize and we talk about these things, I think we can see movement.
Yeah. Judge Clay Jenkins from Dallas County, thank you, sir. I appreciate very much you being here.
Thank you.
Let's give him a round of applause. Thank you, Judge. Appreciate it.